Chapter 36: The SBAR Communication Technique for Reporting. This is an overview of situation, background, assessment and recommendation, and how it can improve interprofessional communication and reduce the risk of harming patients. You'll also learn how it can help your team. You can especially use it after your home health visits as you report to the home health agency or case management or physician about your findings and recommendations during and after your visit. Communication is especially important for home health nurses as they will most of the time not have any team members present in person. Rather, they will be communicating most of the time through phone calls, text messages, or email. Mastering SBAR is a must. Situation, background, assessment and recommendation. The situation, background, assessment and recommendation of SBAR is a communication technique based on the 4 steps of the ABCDE. Situation, background information, assessment of the problem, and recommendation. It was first implemented in 2003 at Kaiser Permanente to improve communication between nurses and physicians in acute care situations. It has been shown to improve healthcare providers' perceptions of precision and communication satisfaction. The SBAR technique can be used both formally and informally. However, if you are using the method formally, it is important to think carefully and eliminate superfluous details. As you work with the process, you should consider leaving out superfluous details and leaving the essential information out. There are sample videos available for reference. If you'd like to learn how to use this communication method, we recommend you watch the videos below. The SBAR technique is a valuable tool for healthcare providers. It is an easy-to-remember structure that fosters efficient information processing. It also helps to define patient expectations. It is essential for developing teamwork and fostering a culture of patient safety. It was created by Michael Leonard, MD, and colleagues at Kaiser Permanente of Colorado. Since then, it has been adopted in the Kaiser Permanente health system. A recent study of SBAR in the emergency department showed that it significantly improved communication among healthcare providers. It also reduced the number of incident reports due to communication errors. In addition, the use of the SBAR tool improved communication between nurses and attending physicians, which improved patient care. It also enhanced the retention of information by recipients of the information. It's a format for reporting. SBAR refers to a form of nursing communication that recommends next steps for the patient's care. The nurses should make a thorough assessment of the patient's condition and make recommendations for further care. They should not hesitate to voice concerns or express their own opinions. If they feel strongly about a patient's condition, they should use the recommendation form to share it with the physician. Incorporating SBAR into a patient's care plan requires significant training, and it may be difficult to change the communication style of senior staff. In addition to using written SBAR templates, nurses can also use the method verbally. They should convey information in a concise manner, without using long sentences. They should try to keep the conversation short and simple, concentrating on the patient's immediate needs, rather than talking for a long time. The other person should have the opportunity to ask questions and ask for clarifications, so that they can be confident in their recommendation. In addition to the use of the SBAR template, it is important to consider the tone of the communication. The tone can be positive or negative, depending on the particular aim of the SBAR. The specific aim of SBAR will help shape the early stage section, as well as the mid and end stage sections. The mid stage section will contain recommendations for the next steps. Finally, it is important to determine what the SBAR format is used for in a hospital or home health setting. Another important aspect of SBAR is that nurses must exercise critical thinking skills. They should take the patient's current situation, background, and assessment data into account. The nurse should also make a decision as to whether to consult a nurse leader or follow a standing order. Critical thinking skills are key to improving patient outcomes. It is crucial to develop the skills necessary to exercise critical thinking when implementing SBAR in patient care. It's an evidence-based strategy for improving interprofessional communication. It is proven that SBAR improves the quality of patient care by facilitating interprofessional communication among healthcare providers. SBAR increased the number of critical patient event notes and improved patient outcomes. The study also showed an increase in nurses' ability to document communication with the attending physician. They also found an increase in the rate of patient satisfaction, working conditions, and climate. It reduces risk of jeopardizing patient safety. Nurses who follow the standards of practice must exercise critical thinking skills to determine what is best for the patient and whether or not it will impact their standing orders or consult with a nurse leader. In addition, they must consider the background and current situation of the patient. The importance of critical thinking is underscored by the positive effects SBAR has had on patient outcomes, but the effectiveness of SBAR rests on the nurse's ability to apply it. Implementation of SBAR requires a standardized communication framework across healthcare providers. This framework may be created by establishing a standardized handoff report process, or a set of characteristics that are specific to a specific SBAR tool. In both cases, the SBAR tool should be used during patient-related communication to ensure maximum patient safety. It is imperative that healthcare organizations implement SBAR in their care settings. The implementation of SBAR will help improve patient safety and overall healthcare quality. Complex problems become simple. First, SBAR is an easy-to-remember mechanism that helps healthcare staff anticipate the information that they need from their colleagues. By prompting staff to formulate information with the appropriate level of detail, SBAR improves communication across the entire organization. Verbal communication is often criticized, but few tools focus on improving verbal communication skills. The goal of SBAR is to shape communications throughout the patient journey and improve patient safety. Using SBAR is important, but it's vital that nurses know the right information about the patient. In the end, the primary goal of SBAR is to provide information effectively,